This video is about the important points for the topic bone disorder and rheumatology. So you should have at least covered all these points for the topic. So rheumatology and bone disorder is under week 2 of our 45-day timetable preparation. The full video for 45 days timetable is given in the description below. You can check the video. So bone disorder, you should know about achondroplasia, growth hormone deficiency, which leads to dwarfism. So achondroplasia also presents as dwarfism, but you have something called as a proportionate dwarfism and disproportionate dwarfism. So what is the difference between both? And in achondroplasia, what type of dwarfism is there? And growth hormone deficiency, what type of dwarfism is there? That difference you should know. And then you have osteogenesis imperfecta. So what are the types of osteogenesis imperfecta and how it presents? At least if you don't remember all the 4 types of osteogenesis imperfecta, at least you should know how osteogenesis imperfecta presents clinically. Then metabolic diseases of bone, you have osteoporosis, osteopetrosis, Paget's disease. The other name for Paget's disease, which is osteitis deformans. Paget's disease is important because of the radiographic features. So you have generalized hypercementosis associated with Paget's disease. And then you should know about rickets and osteomalacia. Both rickets and osteomalacia is caused by vitamin D deficiency, but rickets in children, osteomalacia in adult, that you should know. Then lastly about the von Recklinghausen's disease of bone. The other name for it is osteitis fibrosa cystica, which happens because of hyperparathyroidism. And one classical presentation is the radiographic feature, which has generalized loss of lamina dura. So these are the important things which you should have at least gone through it. So whenever I mention the topic, it's not necessary that you have to read in depth about it, but at least you should know it comes under bone disorder and they all comes under the metabolic disease group of bone disorder, and 1 or 2 classical feature, if it is highlighted, you should know what is a classical feature in that. Next is infection of the bone. You have osteomyelitis and tuberculous osteomyelitis and how it presents. Then you should know a little bit about osteoradionecrosis and bisphosphonate related osteonecrosis of the jaw, or recently they are also called as medically induced osteonecrosis of jaw. So you have to know how it presents and what is the difference between both, and why bisphosphonate causes osteonecrosis. You have to know a little bit about them as well. There is a separate video related to that, so you can go through it for explanation. Then the neoplasm related to bone. So you should no need to know about depth in each, but at least some classical feature in each. So osteochondroma, not very important, but osteoma is important because osteoma, when a patient is having pain, it gets relieved after giving a paracetamol. So that is one MCQ point you should know. Then Gardner Syndrome, the features related to Gardner Syndrome, what all are present in Gardner Syndrome. Then osteoblastoma, giant cell tumor, Langerhans cell histiocytosis, osteosarcoma and Ewing sarcoma. Osteosarcoma and Ewing sarcoma, what is the radiographic presentation for both? That is important. Then in the rheumatology point of view, you should know about osteoarthritis, rheumatoid arthritis, Reiter syndrome and gout. What are the classical radiographic feature for each? That is important. So radiographically for osteoarthritis and rheumatoid arthritis, what are the differences? And in osteoarthritis, what are the classical features which you will see radiographically, specifically in the TMG radiography is important.